Hello, this is Arron Forrester from Belmont Chiropractic. This is a video on what's called a spondylolisthesis, which I know is a really long word. Can also be called a pars defect or a defect of the pars interarticularis. You don't have to remember any of those words. But these things are commonly just called a spondy. And it's a problem that happens when L5, which is your lowest vertebra of your spine, L5 kind of fractures or breaks and starts to move away from the sacrum, which it sits upon. Now that doesn't necessarily cause any symptoms, and these things happen in about, I think, between 3 and 6% of the population. Probably quite a lot more in this office though, because we have a pretty sensational reputation for looking after people with significant low back pain, and folk with this problem will often bounce around a few practitioners before someone takes a film and goes, I know what's wrong with you. So I do have a film here, one I prepared earlier, that I can show you. So what you're looking at here, this is this lady's backside, back there, and this is her sacrum, that big bone, so that's her bum bone, basically, and this is her 5th lumbar vertebra, and then you've got 4th and 3rd and so on and so forth. So with her, all these green lines here should line up, and you can see there's a really big difference. So essentially, this 5th lumbar here has failed in the back and the whole thing has moved forward. All right. Now it's kind of like a broken bone. It's not like a broken arm though. It's not sort of flapping around in the breeze, but we can't keep this thing fixed, stopped moving for 2 months for it to heal. So this is something we cannot fix. But what is amazing about this is you can see there's that hole there. Now there's nerves that come out of that hole, and there's this hole here that you can't really see because it's not really there. The nerves that actually come out of here go to your bowel, bladder, reproductive gear, and all the muscles in your legs. And the fact that this woman, she's had some pain down her leg for quite some time, but the fact she can walk and poo and have her menstrual cycles and all these things, really without any knowledge there was anything wrong, I think is amazing, because there's no space there. But anyways, let me continue. Now that particular spondylolisthesis I just showed you, that's a pretty extreme one. They don't all look like that, but it makes it really obvious, which is why I picked that one. And it was also really difficult trying to get across to that lady what was going on, because this is for all it's a fracture or a break in there, it's not like a broken arm. Your body's going to move in and reinforce that with a whole bunch of cartilage and things, but it's definitely not as strong as what's supposed to be there. Now, my understanding is most of these things come about from physical trauma, and often when you're really little, like sub 5 years of age. So here's a model. So here's a spine. So your bum is back here. The butt crack sort of starts around about there. This is the vertebra here that comes away from this part and starts to move forward. All right. Now, when you walk, this is supposed to happen. These things move a little bit. All right. Now, often when someone has a spondylolisthesis and it's causing them some symptoms, what's happened is one of these joints here has become restricted. All right, and this is I look after this all day. This is your pelvis. Part of your pelvis gets jammed up, can cause pain anywhere down your legs, all sorts of things. But when that gets jammed up, you still have to walk around. All right, so instead of, this guy's hit me in the head, but instead of walking like this, suddenly this is compromised. So this one here can move like that, but your brain then recruits these guys here to work extra hard. All right, so often when you carry that around for 10, 20 years, we'll see these discs start getting real small because they've been overworked and overused. But so what we try and do with a spondylolisthesis is to get symmetry in the way that these big joints here are moving, so that these vertebrae here don't have to do so much work. And the vast majority of the time, that will massively reduce the symptom. Again, we can't fix it. These are really something we've got to manage ongoing, because we can't fix it, and you are more likely to run into trouble with your lower back when you've got a spondylolisthesis. And it's one of those frustrating things where people want to do some stuff to stop it reoccurring, and really it's a list of things not to do, like raking, vacuuming, sweeping. Twisting against rotation is a really good way to flare these things up. The best exercise you can do to stop them reoccurring is to do plenty of walking, have some decent tension through your abdominal muscles, but there's no specific exercise to do to sort these things out, unfortunately. It is a little bit disempowering in that the practitioner's going, look, I'm the only guy that can really help you with this, and that's kind of where it's at, unfortunately. There are some surgical options. They're not great. If you can keep bits of metal out of your spine, you're going to do better. We have some really good success with a spondylolisthesis. So yes, again, purpose of this is just to, I guess, put out to the public we can help these things, but also so you can educate your partner or your family as to what it is that's going on with you, because being told you've got a busted spine is pretty scary, I should think, but we look after these all the time. We're not scared.